phase 3 nadofaragene trial was a Society of Urologic Oncology Clinical Trials Consortium run study. This was the kind of pivotal trial that led to the FDA approval of Nadofaragene Firadenovec for BCG-unresponsive non-muscle invasive bladder cancer. As you know, that happened in December of 2022, I believe. And what we were able to present today was the 5-year follow-up data, which looked at patients who were on study, who, by way of reminder, these are patients, when this trial was designed, it was a very conservative design. So basically, patients had BCG-unresponsive disease with CIS or with or without papillary disease or papillary disease only. And essentially, the patients were given nadofaragene at time point 1 and then assessed at 3 months. And if they had a complete response, which we defined as basically no high-grade recurrence, they were allowed to continue to get retreatments. But importantly, none of the patients got retreatments if they recurred. And so what we found after 5 years of follow-up was that nearly half of the patients in the overall cohort were able to avoid cystectomy, meaning removal of their bladder. And that shook out to about close to 40% of patients in the CIS cohort and about 2/3 of patients in the papillary-only cohort. With respect to patients who were in the CIS cohort, among those who had a complete response at 3 months, at 5 years, about 10% maintained their complete response. And that was about 20% in the papillary-only cohort, again, among those who had a complete response. So this is high-grade recurrence-free survival. So, those numbers reflect kind of a pure treatment population, meaning these are patients who did not get retreated if they failed at an earlier time point. They reached complete response, for example, in the CIS cohort at 3 months, and then they maintained that for that period of time. So there was no reinduction at all. And that kind of segues to, some of the upcoming trials that are in the works for investigating nadofaragene further. For example, the ABLE-42 study is interested specifically in looking at whether retreatment for patients who might recur could have an impact on achieving a complete response, because none of the patients received retreatment if they had a recurrence. We found that there were no new safety signals at all at 5 years, which was very significant. Importantly, only 2% of patients discontinued the study drug at any time for side effects. And there were no study drug-related grade 4 or 5 adverse events. With respect to the most common types of adverse effects or side effects that patients had, they typically included things like leakage around the catheter, urgency, frequency, that sort of thing, which many patients who've gotten BCG before are familiar with, and their providers are as well.